Our favorite dentist finally back with us. It's been a while. Dr. Brian Dunlap is here to talk about gum disease. A lot of pain can come from your gums.
That's correct.
How do we kind of prevent this?
Well, I mean, gum disease is probably one of the more important things that we need to talk about because there's about 50% of Americans that probably suffer from some sort of gum disease, from mild to moderate to severe. And the scary thing about gum disease is it really doesn't start being painful or uncomfortable until it's pretty advanced. And so that's the big problem. That's why we want to talk about that. These days at the dental office, when you come in to see us, the first thing we check out are your gums and your bone. Because it doesn't matter how good or bad your teeth are. If the gums and bone are bad, you're going to lose those teeth. Yeah. So that's the most important thing that we focus on these days.
Periodontitis, did I say it right?
Periodontitis.
Yeah, sure. There are symptoms that you can know about where your gums are starting to affect you.
Right, and we have a little graphic up on the screen. You know, healthy gums are pink and tight and, don't bleed very easily. When gums get real red and swollen and irritated and they just bleed when you barely brush or floss them, those are signs that you've got some problems in there and you definitely want to go see your dentist.
Well, and you can see, the range here from healthy gingivitis. Right. All the way down to where you've really got some trouble. When you brush, if you're bleeding, is that the first sign that you're here? Yeah, I mean, have you already progressed?
Well, you're probably in the middle somewhere, and just a little bit of red gums and a little bleeding may be gingivitis, and that's usually easily cured if you'll just show up at the dental office and get a professional cleaning because there's tartar that's on your teeth that you can't get off with a toothbrush. You need a hygienist to get that off or a dentist, and then that will really help those gums clear up in about a couple days.
Well, let's talk about once you get down here. Where are you going to? Where are you leading to here?
Well, when you get down to here, you definitely need to be seeing a dentist or a specialist, and we need to address that problem because at this point, you're risking losing lots of teeth. I mean, this is the #1 reason that people end up in dentures. And folks, we don't want you in dentures. We want you to have your teeth, be smiling and happy.
But there are other health concerns that can come because of this, right?
Well, absolutely. We could go into that a lot. With gum disease, there's a lot of studies that talk about the links in the bacteria that's in gum disease and heart disease. And there's definitely a correlation. So we found that people who have very unhealthy mouths also have problems elsewhere in their body. So it's not just your gums and your teeth that we're worried about. We're worried about the whole body.
Great information there. So if you've got gums that are hurting, bleeding, make sure you check out your dentist. I know that Dr. Dunlap would love to see you and help you out.